So see, on the left side of the screen, that's how having, keeping my hair up, I like his skin. Until one day I was talking to him about...
You liked his skin because some parts was not growing.
Well, that is true. As you can see on the right side of the screen, which is the main reason, I was leaving it bald. But the patient was looking at me in US one day and said, "You are telling me to do it for hair restoration." And he said, Then he kept quiet. He didn't say any further. But I could tell what he was thinking. He was looking straight up.
That you need it too.
Exactly. And so, the addict that we have in Africa here, that you are sure, of what you have, you should use it.
Yeah.
So then late last year, I decided to have the treatment. And you can see about 4.5 months later,
wow,
there's been improvement.
Wow.
And one good thing about platelet-rich plasma therapy, including adult stem cell therapy, is even after the treatment has been done, there's still continual effect of stimulation repair, because when damages are done, they are not done in one day. So the repairs too are going to be gradual. And patients continue to see the benefit.
Okay, so tell us this process. Which part of your body was the platelet? Okay, from the platelet, you start injecting.
All right, let me make
please.
it simple. Just like the previous picture that you showed in stages, drawing the blood, you process it with special FDA-approved machine, and then from the separation of the red blood cells at the bottom and the plasma on top, you end up, extracting the section of that plasma, the yellow part that is rich, with platelets. So that portion that is very rich with platelet that you're going to use and inject, in a certain way into the scalp. But you can also have
into the scalp.
Yeah.
That's painful.
No.
Okay.
Well, let me take it back. If the doctor knows what he's doing, he can always make the patient comfortable.
Okay.
That is what it's all about, the comfort. You numb it, you do nerve block, and then patient will smile. Okay. And then, you can just inject only the PRP, the blood, or the other items you can inject, either certain vitamins, some cell and stuff like that, that will make the hair thicker, fuller, healthier, not just only the PRP.
Okay, so your own scenario, it took like 4.5 months before the hair.
Oh, no. Within 4-6 weeks, I already have improvement. My hair also, You see, in US.
So for those who have, their hair is so receded, or for men who are dealing with bald,
okay.
they can have this and have their hair back.
They still need, I don't want to say 100% yes, because they still have to go for consultation with their doctor, and have that possibility, or, being reassured what to expect. I would say 90% of people will be yes. But if somebody is already having like a very shiny, like Lagos Ibadan Expressway in those days, the hair will still grow, but it will be scanty.
Okay.
So you must have some...
Of course, if it is that shiny and then something is still growing, that means there's results. So is it that, let's look at it, can we take the platelet from someone else and use on another person?
For the way regenerative medicine is done, the answer would be no. But for the adult stem cell, because the adult stem cell is mainly autologous, most of it. There's also allogenic. What I mean by autologous...
Can you break the terminologies down?
Autologous is you are taking it from the patient and you are giving back to the same patient, who's the donor and the recipient. So you take the patient's own blood, you give back to the patient. You don't need any cross-matching. When you talk about allogenic, someone else is the donor. The donor and the recipient are different. And there you have to do cross-matching and HLA compatibility.
Perhaps family members will be better.
Yeah, actually the best match are always family members, especially when you talk of treating sickle cells or leukemia. you have to find a donor in the family who is close match to the, to the recipient before you go further to harvest the bone marrow to try to cure the sickle cell or leukemia.
That's for the adult stem cells therapy, or for both?
That, for adult stem cell therapy. Okay, let me take this back so it's not confusing for people. Stem cell is nothing new. Since 1908, that's when the first doctor used the word stem cell. In 1968, bone marrow transplant was done between two twins in USA.
Okay.
And all medical doctors know about bone marrow transplant. That is also stem cell.
Okay, we'll just take a quick break, and when we come back, we'll talk more about, who can benefit from this type of regenerative medicine. To stay with us.